Hi, everyone. This is Paul Casey. I'm the Chief Medical Officer at Rush, and here to provide an update on our COVID awareness as well as our COVID preparedness now as we transition from the fall into the winter. As you've heard, there has certainly been an uptick in COVID activity in our community over the past month or so, and we're seeing that throughout the state, but also a lot more community spread in a lot of areas that may not have seen it as heavy back in the spring. And that really leads to one of the other questions that I'm commonly asked is what's different this time around in the way that we're treating COVID? Really, over the past 8 months, we have learned an extraordinary amount about not just COVID, the disease process itself, but really how to manage patients with COVID. We have a lot of new modalities, new treatment modalities that we wouldn't have been doing in community hospitals necessarily a year ago. We do proning, for instance, in which we lay patients on their stomach to improve their oxygenation. And that's something that's much more widespread now than it was in the spring as a treatment approach for a COVID patient. We also have some new therapeutic modalities. A lot of these were in trials as we were going through the spring and we were learning more about the right approach for the right patient and really customized medication approaches. We're seeing more patients successfully discharged home. So we need to continue to do everything that we can to really contain that spread. We need to do the things that we know are effective, and that is adherence to our masking, it's social distancing, so maintaining that 6-foot distance when possible with a mask on, as well as hand hygiene. Those are really the fundamental things that we know work. We got through this successfully in the spring when it seemed like an unsurmountable challenge, and I have no doubt that we are going to successfully get through it this winter as well, and that there's brighter times ahead.